Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in today's episode I want to answer another question from one of our readers, Craig. And Craig asks, "Hi Patrick, my mum is in intensive care with COVID-19. She's on a ventilator with a breathing tube. The intensive care team wants to do a one-way extubation and let her die. What do I need to do to save her life?" So let's look at what Craig writes in. "Hi Patrick, I need help. My mum is 76 and has been on a ventilator for over 3 weeks with a COVID-19 infection. I am locked out of intensive care and I can't visit her. The ICU has brought ventilator settings down and she's breathing on her own now for 2 days. She has passed the pressure test. The ICU spent the day reducing her sedation for 4 hours and tried to wake my mother up with a breathing tube in place. The ICU told me that she was in a great deal of pain but didn't open her eyes and wasn't able to communicate or follow commands. The ICU doctor said that my mother was in such pain they had to end the spontaneous breathing test. The ICU doctor told me they believe it is cruel to do a new spontaneous breathing test. The ICU doctor want to have a telephone conference with her and palliative care team tomorrow and myself, and I have to be strong. I want them to make more than one attempt, maybe 4 to 7 more attempts after 3 weeks. My mother's blood pressure is 115 to 135 systolic over 50. The ICU is also saying she is in multiple organ failure. From my perspective, the heart appears undamaged, the lungs are vented now, and the kidneys are stable. The fluid going in is 2,400 mils per day and 500 mils out, so my mother has edema and third spacing fluid accumulation. My mother's kidney function was 10 mils to 20 mils an hour before in the first week, and now she's up to over 500 mils. The blood has not been taken as often as before. The ICU is calling it comfort care, blood work, not daily labs. The creatinine level is 7. Last week, BUN was 118 and GFR was less than 5. I don't know what to do. Should I push for more spontaneous breathing tests? Also, my mother has an advanced care directive and wants everything to be done. I feel like at the age of 76, it's not good enough what the ICU team is offering. And I'm also concerned that with the current COVID-19 crisis, the ICU is pushed for beds, and one way for them to empty their beds is let my mother die. What should I do?" From Craig. Hi Craig, thank you so much for being a client, and thank you so much for writing in, and we have been on the phone as well, so I know your situation firsthand. Let me start with this and address a much bigger issue here before we break everything down for you, Craig. ICUs are busy all year round. Most ICU beds are occupied all year round, and there's almost not a single day around the year where ICUs aren't pushed for beds. They're busy, and they're pretty much working at capacity all year round. Now, with the current COVID-19 situation, with the current pandemic, ICU beds are in even higher demand, and and that puts even more pressure on ICUs. So one way for ICUs to manage beds, staff, equipment, and other resources is simply by not prolonging treatment, whereas during other times maybe they would continue treatment because they're not too pushed for beds. Yes, they are often pushed, but sometimes outside of the COVID-19 situation, there is a little bit more leeway. But if you have followed my blog for any length of time, you would know that ICUs are pushed for beds all year round, but the current situation is just making it worse. So your assumption that the ICU team doesn't want to give their all to get your mum out of ICU alive is accurate. The other added on complexity at the moment is that most ICUs have locked out families. And again, if you have followed my blog and if you have followed what I'm talking about for any length of time, you would know that even if families can enter ICUs, it's very difficult for them to get to make any informed decisions, get peace of mind, control, power, and influence, even if they can be physically there, because they simply don't know what they don't know. They don't know what to look for. They don't know what questions they need to ask, and they don't know how to manage doctors and nurses, because there are ways of managing doctors and nurses in intensive care to get the outcomes that you want. So at the moment, this issue is heightened because you are not allowed to visit. So, but let's break this down for you, Craig, so you understand what needs to happen for your mum next. So the first thing that you need to understand is, I am surprised that you haven't mentioned a tracheostomy, and I know when we spoke on the phone, you have told me that the ICU has not talked about a tracheostomy, which is also telling me they're not open and transparent with you. One thing that would definitely prolong your mum's life is doing a tracheostomy, but they haven't even suggested that to you, which again is telling me that they're not open and transparent with you. And it's also telling me that, again, the biggest challenge for families in intensive care is that they don't know what they don't know. The devil is in the detail. You not knowing about a tracheostomy is potentially putting your mum's life at risk, and she could die because you don't know, because you are the one that needs to suggest sometimes as well. But that's what I'm here for, of course, to point you in the right direction so that you know what treatment options are available. Quickly talking about a tracheostomy, when somebody is ventilated for over 10 days, 14 days, and they can't come off a ventilator, they need to have a tracheostomy to let them wean off the ventilator in their own time. So the spontaneous breathing tests have been failed many times now, but then the next step is not to do another spontaneous breathing test, maybe one more, but the next step is to simply do a tracheostomy. And once a tracheostomy has been done, your mum can come off sedation. She can come out of the induced coma. Right, and that makes it so much easier to get off the ventilator. You are talking about, that your mum has been ready in recent days to come off the ventilator. She was breathing with good tidal volumes, minute volumes. Her arterial blood gases were good. She had minimal secretions. She was obeying commands. She had a good strong cough. You were telling me all of that, Craig. But then the question is, why didn't they act on it then? That's again. Sometimes you need to be the one driving it. Most families, 99% of families in intensive care don't believe they can drive it, but they can, with help from us, for example, where we can challenge the intensive care team on a clinical level, something families can't do because, again, you simply don't know what you don't know. Intensive care is such a highly specialized area. When somebody is in intensive care critically ill, there's 10, 20, 30, 40, 50 things happening simultaneously, and they are all important to understand and assess a patient, and only then can you make an informed decision, right? And that's where, again, if you don't know what you are looking for, it'll be very hard for you to drive any improvement for your mum, and it'll be very hard for you to challenge the intensive care team. Anyway, so you said that she wasn't in pain a few days ago, but now she is in pain. Again, that breathing tube should have come out a couple of days ago. You couldn't find out why it didn't happen, but now the next step is to do a tracheostomy. That is the very next step. And the ICU team hasn't suggested that to you because they simply don't want to invest the time, the resources, the effort, and also the emotional investment to do what it takes to get your mum off the ventilator. And they haven't even taken the time to inform you about a tracheostomy. But again, we have so many articles and, video blogs about tracheostomy, when to do a tracheostomy, what it's there for. and so forth. But a tracheostomy for your mum is the next step, and then she can be weaned off the ventilator in her own time. The other question that you need to ask, Craig, is, as I mentioned before, a tracheostomy should be done after 10 to 14 days. Now you're telling me your mum was on sedation for over 3 weeks. You mentioned initially she was on propofol, then she went on to midazolam or Versed. So the longer somebody's on sedation and in an induced coma, the more difficult it is to wake up after an induced coma. So again, that's why I said a tracheostomy should have been done after 10 to 14 days. No more needs for sedation after a tracheostomy has been done, right? Which means your mum could have by now potentially be off the ventilator if she had the tracheostomy. Again, the biggest challenge for families in intensive care is that you don't know what you don't know. I have seen this hundreds of times, probably thousands of times, those situations, after I have worked in intensive care for 20 years. So, it's bread and butter for anybody working in intensive care to do a tracheostomy after 10 to 14 days and then wean a patient off the ventilator. It's so much easier because, again, tracheostomy eliminates the need for sedation and induced coma. And then your mother can have physical therapy. She can sit out of bed. She's just so much more flexible, So that would have been so much easier. Anyway, it's not too late, of course. The next step is for us to advocate for a tracheostomy. And then also, if pain is an issue, okay, the question is, where is the pain coming from? What needs to happen to manage the pain? She shouldn't have necessarily opiates like morphine or fentanyl to control the pain, because morphine or fentanyl, the main side effect of morphine or fentanyl is respiratory depression, which makes it even harder for your mum to come off the ventilator. So they need to look at other, maybe less potent pain medication to manage the pain. Maybe Panadol, maybe a little bit of Endone, which is morphine based as well, but something maybe in between, a little bit stronger than Panadol or paracetamol and not quite as strong as morphine or fentanyl. So again, those are the issues that haven't been looked at by the sounds of things. The ICU team is telling you that apparently it is quote unquote cruel to do more spontaneous breathing tests for your mum. Again, that is their frame of mind. We need to push back on the Advanced Care Directive. The Advanced Care Directive of your mum says that she wants everything done, which means there is no indication that your mum wants to die. She has made her wishes very clear. The ICU team wants to move towards a withdrawal of treatment, and again, they can't do that without your consent, and they can't do that without following their own policies and procedures, which means they are not allowed to just withdraw treatment without your consent. That's killing someone. That is murder, right? So you always got to be aware that the ICU team is not operating in a vacuum. They can't make decisions in a vacuum, life or death decisions in a vacuum, even though that's what they're implying, because that's how they're running ICUs. They're always implying that they can make life or death decisions in a vacuum, but that is not accurate. And again, the biggest challenge here as well is that families in intensive care don't know what they don't know. They don't know what questions they need to ask. They don't know how to exercise their rights, because you do have rights. You are saying that the ICU team thinks it's cruel to do another spontaneous breathing test. Well, what is cruel is to kill your mum. Do a one-way extubation, remove the breathing tube, not put it back in. That will kill your mother, right? And that is cruel. So you're also talking about that her blood pressure is stable, 115 to 130 systolic, with a diastolic blood pressure of 50 without vasopressors or inotropes. So that's good. That means, your mum's heart is strong. Doesn't look like she's septic, which also means, it looks like she's overcome the COVID-19. Well, maybe not quite yet, but if she's not on vasopressors or inotropes, it's a good sign that she is not septic and that she's overcoming the infection. Now, you're also talking about that the intensive care team says she's in multi-organ failure. And again, thank you for sharing all the information, because again, that is not accurate. Heart is strong. Yes, the lungs are impaired still, but there are ways of moving forward with that, with a tracheostomy. Again, they're telling you that she's in lung failure and that she can't come off the ventilator, but they're leaving out that she needs a tracheostomy as a next step. So they're leaving crucial and also life-saving information out of the picture, right? And if you don't know what questions you need to ask, you will never get the full picture. You will never get all treatment options that are available for your mum. Because again, the ICU at the moment, and during other times as well, is trying to manage their intensive care beds. They need more beds because they have more patients queuing up for those beds, unfortunately. But you need to be aware of those dynamics so that you can get the outcomes that you want, need, and deserve for your mum, going back to your mum's advanced care directive, which states she wants everything to be done and she wants to live. Now, you talked about fluid balance, and it is concerning that your mother's fluid balance in the last 24 hours has been plus 1900 mils. No wonder she's edematous, and no wonder she is third spacing and she has a lot of fluids accumulated in her tissues. Now, with that being said, one of the biggest challenges when in kidney failure is fluid accumulation in the lungs, which again is particularly challenging when somebody needs to be weaned off the ventilator. And it could also be why your mum had setbacks in the last few days, because she had fluid overload, pulmonary edema, and couldn't come off the ventilator or can't come off the ventilator because of that. Now, what is important now is creatinine is 7, too high, the BUN is 118, too high, GFR is less than 5, too low, which means she is in acute kidney failure. Now, I don't know whether they've tried Lasix or furosemide as a diuretic to wash out or to get the kidneys started. The next step clearly is in this situation to start her on dialysis, and she has a very good chance to tolerate the dialysis, especially since she is not on inotropes or vasopressors, right? Once dialysis is started and she can have fluids removed, then hopefully she can offload fluids off the lungs, have the tracheostomy, and then come off the ventilator. So you see, there is room for improvement. You just need to ask the right questions, and you just gotta, keep pushing back to the ICU team. ICU teams always treat families in intensive care as if they're stupid, right? They always assume that they don't know anything and that they can just tell them whatever they like. And they do that if you don't question, So the situation that you're in is you haven't asked the questions early enough. But now, thankfully, we can ask the questions, and now, thankfully, we can move the situation forward and help your mum to get a tracheostomy and then come off the ventilator in her own time. And even if she can't come off the ventilator, you could look at services like intensive care at home. You can check out intensivecareathome.com for more information there, and then go from there. So, Craig, that's the next step. We need to talk to the ICU team next, suggest a tracheostomy, reiterate your mum's advanced care directive, which is she wants to have everything done. If they don't do everything, in essence, that's murder, right? And you got to more or less rub that into the ICU team's face, because again, you have rights and you need to exercise those rights. Well, thank you for watching, and thank you again, Craig, for being a client. So how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly, whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what is really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what is really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also have a look at our blog section for more tips and strategies, or you can send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site, intensivecaresupport.org, for families of critically ill patients in intensive care. You can also call me, find phone numbers on the top of the website. Also, have a look at our ebook section, and you can also get one-on-one consulting and advocacy with me over the phone, via Skype and via email by clicking on the relevant tabs on the top of the website. Thanks for watching. This is Patrick Hutzel from intensivecarehotline.com, and I'll talk to you in a few days.